than the medic.
Hello and welcome to this lecture in the lecture series. Today's topic is atherosclerosis. So, when you hear atherosclerosis, what comes to your mind? Atherosclerosis is the most common type of arteriosclerosis. Now, I want you guys to remember that we have three basic types of arteriosclerosis. The first one being atherosclerosis, which is the most common one. And then also we have another one that is called Monskeberg arteriosclerosis. And then of course the last one, which is the arteriolosclerosis, that's of the smaller vessels, smaller arteries, and also arterioles. Atherosclerosis is a multifactorial inflammatory disease of the intima manifesting at points of hemodynamic shear stress. So what this means is that when there is stress exerted on the intima, you have all these small microscopic tears that over time results in accumulation of inflammatory factors, be it lipids or some other things that we'll get into later. So it is characterized by buildup of cholesterol plaques in the intima, and it affects elastic arteries and large or medium-sized muscular arteries. So as for the epidemiology, we know it's the leading cause of vascular disease worldwide, and then it is much more prevalent in men than in women because we know estrogen has an LDL lowering effect. The only time that the ratio between men and women is approximately equal is during menopause in women, because we know that the level of estrogen reduces during menopause. So when the woman begins to approach around 50 years or even 40 years and above, she begins to experience low level of estrogen, and then the risk of atherosclerosis increases. So the etiology is divided into modifiable and non-modifiable risk factors. The modifiable risk factors include smoking, because it can be stopped, diabetes mellitus, arterial hypertension, if you take your medications, it can be reduced, dyslipidemia, high homocysteine levels, obesity, stress, and increased alcohol consumption. And as for the non-modifiable risk factors, of course, we have family history and then also age. So males that are 45 years and above and females that are 55 years and above. So that's postmenopausal women. So now, as for the pathogenesis, basically, chronic stress on the endothelium can lead to endothelial dysfunction. And then when there is endothelial dysfunction, there is now like invasion of the inflammatory cells, and then we have adhesion of platelets to the damaged vessel walls. When these platelets adhere to the damaged vessel walls, we now have platelet release of inflammatory mediators, like for instance cytokines, and then also PDGF, that's platelet derived growth factor. And then this platelet derived growth factor stimulates the migration and proliferation of smooth muscle cells to the intimal layer. So this results in inflammation of the vessel, and then we'll now see that macrophages and smooth muscle cells begin to ingest cholesterol from the oxidized low density lipoprotein. And then when it ingests this cholesterol, it becomes what we know as foam cells. Then these foam cells over time begin to accumulate, and then they form what we know as fatty streaks. These fatty streaks are what are known as the early atherosclerotic lesions. Then all these lipid-laden macrophages and smooth muscle cells begin to produce extracellular matrix that is in form of collagen. And then this now leads to development of atheroma, which is the fibrous plaque. So the inflammatory cells in the atheroma secrete matrix metalloproteinases. And then this metalloproteinases cause weakening of the fibrous cap of this plaque. And this weakening is due to the breakdown of the extracellular matrix. So minor stress can rupture this fibrous cap. And then also there's calcification of the intima. So later on, due to this weakening of the fibrous cap, when there is now plaque rupture, there is now exposure of thrombogenic material, and then eventually thrombus will now form. And when this thrombus forms, there will be occlusion of the vessel, or there can be embolism. So thromboembolism can also form in this case. So that's basically the pathogenesis of atherosclerosis. Now we have to know the common sites in the order of increasing frequency. The first one with majority of the cases is atherosclerosis of abdominal aorta, then followed by coronary arteries, then popliteal arteries, then carotid arteries, and then with the least amount of cases, atherosclerosis of the circle of Willis. So now we need to know what atherosclerotic diseases are. If you remember from the pathogenesis, there is weakening of the vessel wall, and then this weakening can cause arterial aneurysm or dissection. And then also, due to this plaque formation, there can be something known as demand-supply mismatch. And then this is manifested in the case of coronary heart disease, peripheral artery disease, intestinal ischemia, and subcortical vascular dementia, also known as Binswanger disease. There can also be thrombosis and thromboembolism, like in the case of acute coronary syndrome, like myocardial infarction, and then also in the case of stroke. And then also there can be renovascular hypertension. So the way it occurs is that when there is atherosclerosis in the renal artery, it can lead to activation of renin-angiotensin-aldosterone system because the amount of blood flow that is reaching the kidney is not enough. And then your kidney will think that it needs to increase the blood pressure. So this is actually a compensatory mechanism, but it will be detrimental to the person's health. That's the end of the video. Be sure to leave a like and subscribe if you haven't.